Welcome to a new episode of the Covetrus Connected Care podcast. I'm your host, Nicole Knight, and I'm Content Marketing Manager at Covetrus. Thank you for joining us. The power of the human-animal bond makes pet parents feel passionate about their furry family members. When the subject turns to health-related costs, the result can be emotionally charged conversations between pet parents and veterinarians, particularly when budgets are tight and treatment decisions become life or death. How can veterinary teams successfully navigate these conversations to benefit patients, to benefit clients, and practitioners? Our guest today is Jonathan Wainberg, Senior Vice President and General Manager of Pet at CareCredit, a Synchrony solution. CareCredit, a health and pet care credit card with flexible financing options, helps pet parents finance veterinary services, treatments, and diagnostics, and is a corporate partner. Jonathan, welcome to the show.
Thanks for having me. I'm excited to be a part of it.
Same. So to start, tell listeners about any furry family members you have at home.
Well, I got one right over here, and I know this is a podcast, but you're going to get to see her. This is Miss Maddie Wainberg, and she is a miniature poodle. She is 13 years old now, so she looks very young. Listen, she exfoliates. She takes care of herself. Here's an interesting stat about Maddie. She has been to, if you can believe it, 11 countries, and she has lived with me in Hong Kong and in London, and now we're in the U.S., and, she has been just such a great companion. She has an older human sibling now, a younger human sibling, I should say, a 5-year-old human. But she's just great, and she's been such a great addition to our family, and has made such a difference for us in our life. So we're very delighted. I certainly am super excited to be working in this industry because I have such a passion for our pet family members. And, Maddie actually is a good person to have some of these conversations with as our chief pet officer. She sits behind me all day. She could probably do this podcast a lot better than I can, if you could speak her language, which we're still perfecting.
Well, it's so fun to meet such a well-traveled pooch. And I also have a little bit of an older pet. Roxy, my Pomeranian, is going to be 13. So it's so important to keep them healthy as they age. So question for you. More households than ever have pets, but we know from the Synchrony Lifetime of Care study in 2022 that nearly half of pet parents underestimate the lifetime cost of caring for a cat or dog. Can you walk us through findings from the study on financial preparedness and pet care?
Absolutely. Listen, this is a study we commissioned in 2022. Just the fact that we're still talking about it shows how much it has resonated and how much it's really taken the industry really by storm, because it is such an important thing. Pet ownership is at an all-time high, but the cost has always been vague, right? No one really knows what we're getting ourselves into. What I do know is you're getting yourself into a partnership, a covenant, that you're going to take care of that family member, just like you're going to take care of your human family member. But generally, in human health or in human costs, you have insurance, and insurance that is provided by your employer or provided by the government. You don't really Here, of course, with a pet, you are responsible and you're on the hook for all that stuff. So it's so important to really know about these things. And so we said throughout our research and talking to our veterinarian partners, what's something that we could really help the industry with? And they're like, this is something we think is an area that can really help define pet parenthood and prepare potential pet parents or current pet parents on what that commitment is going to be. We interviewed 1,200 pet owners and 100 veterinarians, and it included an exhaustive list of dog and cat expenses from first year stuff, right? Spaying, neutering, vaccines, you name it, to food and health insurance, and to end of life expenses. And we had 3 really big takeaways. The first one is that pet owners could spend as much as $55,000 during a pet's lifetime. And I was going to say, as much as Maddie, even more, obviously, with all her travels around the world. She's got 3 microchips. She's got one for the US, one for Hong Kong, and one for London, and just all the stuff in between. But generally in that grouping that we selected, it was at that $55,000 level where you can go. Nearly half of pet parents underestimate the cost of caring for their pets, which leads to the third kind of takeaway point is that 30 million U.S. households will face an unexpected pet expense that will cause them financial worry because they're not prepared for that eventuality, unfortunately. If you think about it, over the course of 1 year alone, pet owners could spend an upwards of $3,000, $2,800. Dog owners between $1,300 and $2,800, and cat parents between $1,000 and $2,500. So, in costs in the first year, this is just the first year, but, it's vaccination, pet supplies, and foods. And it's so important that prospective pet parents understand what kind of relationship they're getting into and what kind of responsibilities it is. A lot of people kind of said to me, are you trying to scare people away from being pet parents? Absolutely not, right? I could tell you, it's such a valuable thing. And you talk about the human-animal bond and everything that we share. It's valuable to our own health. It's valuable, not just physical health, but mental health. It's such a valuable thing to raise a family and have a pet be a part of it, the love and everything you get. We just think that it's so important to kind of know what you're getting yourself into so that you can be prepared and that family member of yours gets the care that they deserve and that they need.
Oh, 1,000%. And I'm just thinking as you're talking too about this article that I think I saw in the Atlantic a couple years ago about how most American families, I believe that's what it was, couldn't come up with $400 for an unexpected expense. I mean, that is the unfortunate reality. And so that, of course, spills over to caring for their fuzzy family members. We also know from the Lifetime of Care study that many pet parents take their pet to the veterinarian when there's an emergency rather than for routine preventative care. Yet, preventative care can catch diseases earlier when they're easier and frankly less costly to treat sometimes. So what is it you make of this apparent disconnect?
Yeah. Nicole, I think it's similar to human health, right? There's some people that get their physicals done every year and there's people that don't, right, to some extent. And the reason why insurers in human health give you your physical for free, right? It's generally one thing you don't have to pay a copay for when you have a health plan, right? Your employer's sponsored health plan or another one, is because they know if you get that annual physical, things are going to be spotted earlier. Things are going to be spotted before they can need more acute care later on. And I think it'd be great if all pet owners brought that same mentality to that. But just like in human health, people have the choice and people have different, ideas of the best way. And so what we see is that you're right. There is, unfortunately, a lot of first-time vet visits tend to be emergency vet visits when maybe they didn't need to be, right? And it's not just necessarily first-time vet visits, it's the follow-ups and so on. So, we know one of the biggest barriers to care is how uncomfortable conversations about finance can be when you're talking about someone's health. It's not something we normally talk about, especially in human health, right? But we do talk about it in animal health. It's just a part of the system, right? And so that's why we worked with the AVMA on the language of veterinary care, to work with the veterinarians, to work with the vet techs, to work with the practice managers, to try to find words and phrases and tones that are going to resonate more with that pet parent as they're going through this decision on how to care for their pet and how to get the optimum help for them. It's difficult. Listen, it's easy. I'm here in my home office. I'm not the ones having to have the conversation. We know, and I know that the people listening to this tend to be, people working in veterinarian practices, right? And so we know that they're the front line, right? And so anything we could do, we want to do to help them be able to have that conversation, because you don't want to have to choose between this expense and the other. And so we really work together on certain words that we think can do better with budgeting versus cost, and how do we talk about the right kind of treatment plans. And transparency is so important in this business because, again, people are not used to weighing different costs for different procedures, right? But when you get it for a pet, it's like, okay, here's option 1, 2, and 3. You don't really get that in the human healthcare. So really spending the time and explaining to them the difference of that and what the outcomes are is so critical.
Yeah, I definitely want to dive into the most effective ways that you learned from that study. But let's stay with this just a moment longer. What is it, in your experience, about unexpected veterinary expenses in particular that can be so stressful and challenging for pet parents?
I think it's because our pets don't speak, right? And so we're so stressed out as pet parents on what is actually wrong with them. And it's so hard for us to fully understand what that is. The veterinarian or the vet tech or the people in the vet office, there are, translator, if you will, as much as it can be to that pet. You have just less control, right? To know what's bothering them. And so I think that puts so much additional stress into it. People like to control things that they can't control. It's the human nature, right? And so I personally think I'm speaking more as a pet parent than someone who runs some pet businesses. That's how I view it. It's like I'd love to know why she's walking that way, or did she step on something, or is this what's hurting her, or so on and so forth, right? And so when you lose that element of control, then you rely on that other person who you're counting on. And I think that's where some of that kind of tension goes, because they know that they're deciphering what, or as best as they can, what the issue is with their patient.
Are there specific resources or tools that pet parents can take advantage of, that veterinarians can extend to pet parents in these instances?
Absolutely, and that's a big part of why we're here today, right? Like all Americans, pet owners are navigating the impacts of inflation. We're seeing it across the board. Veterinary prices are rising due to medical advances, rising cost of labor, drug supplies, diagnosis, you name it, right? And the cost of keeping a pet happy and healthy has gone up, right? Let's not bury our heads in the sand and pretend that isn't something that's impacting our industry, which then impacts pet parents having difficulty to decide if this is a treatment that I can do now, or if it's something I could delay or defer, right? Or not even do, right? And that's the last thing we want to see, right? So listen, no pet parent should ever have to choose between cost and care. Through Synchrony, we have 2 solutions, CareCredit and Pets Best, which are dedicated to helping pet parents navigate the budgetary issues and the financial issues that being a pet parent can bring, right? This enables you to help manage your expenses and your cash flow and be able to take care of your pet at the same time. We offer a variety of plans that provide not just emergency insurance coverage, but also wellness plans, and also accident and illness only ones. And you can go and choose what's right for you. And what I'd add is that these 2 products work great together, because in the insurance environment in the United States is a reimbursement model, so you have to go out of pocket. So we have an incredible amount of our customers use CareCredit and Pets Best together and get reimbursed and pay off their CareCredit bill when their Pets Best claims come in. And so these products work extremely complementary together. We're also working with the veterinarians and the vet techs and the practice managers. We know how this boom in pet ownership has put a lot of stress on practices, right? And so one of the things we're doing is working with your team. We're working with Covetrus to make workflows easier, right? And quicker. So we bring them an integrated payment financing solution over time. So, CareCredit is integrated with Pulse, with Covetrus Pulse, with AVMA, with Impromed, right? And it makes that payment experience faster, and it makes the whole process a lot smoother, because it allows you to do everything within that practice management system, enhanced workflows, cash flows. By having all of the CareCredit information and tools in that PMS, it just makes it a much more seamless procedure. And the same thing comes with, even applying for credit or seeing what's available on your credit, is something that could be managed through that. We've, together with Covetrus, also sending out QR codes for applications so that you remove the burden sometimes, because the veterinarian or the vet tech doesn't necessarily want to have that conversation about financing. Well, putting those QR codes or those custom links, it's something that someone could very easily do, self-service, get that done. And it's just really about moving things easier, making things easier. And so when you think about it, it benefits the practice, it benefits the pet parent, and most importantly, the person who we're looking after and who we're trying to take care of, it benefits that pet.
That's so crucial. But you also mentioned the veterinarians, and there's a stat I want to throw at you that really hones in on that point. 77% of veterinarians reported that their clients' financial constraints, so their financial hardship, these conversations they're having to have, significantly contributed to their feelings of professional burnout. And we know what a big issue burnout is right now. And so that's from a report in the Journal of the American Veterinary Medical Association, and we'll link to that in our show notes. So it just, to me, that speaks even more to the fact that coming up with solutions to improve access to care can help patients, of course, but also practitioners and then pet parents as well.
Yeah, it's tough, right? It is, right? When you think about all the great people that work in the vet practices from across the board, they went into this business, this industry, to help pets. That's what they're focused on. And they're being, I wouldn't say forced into it, but they're having to have other conversations which, number one, aren't necessarily extremely comfortable to have. And number two, it's not something that, they want to be in there in the exam room, and they want to be spending time with healing your pets or making sure that they're healthy. They don't want to start talking about interest rates and APRs and credit checks and stuff like that, right? That's not, I don't, when I was growing up, that's not what I wanted to do either, but here I am, right? And the world is where you are, but I'm lucky to be.
But you make it so fun to talk about.
It makes it easy when you're dealing with pet health, because it's something that you can be passionate about, and you're helping, save lives and make great outcomes. But, in short, words matter, and there's often a disconnect between what is said and what is heard, whether it's because it's the pressures of time, and with all the practices being so in demand and not having as much break time for people in between patients to have that time to really kind of think through those conversations. But speaking pet owner is critical, right? And a fundamental shift in the way veterinarian teams communicate can significantly influence a pet owner's perception about the value and importance of veterinary care. We know that the AVMA, we did that study, we worked on the language of care. That's why we put that study to work, and we shared with, vet practices. This, I don't have it in front of me, I'd show you, but these flip charts of use this word maybe instead of this. And so here's a few things where, I think 3 takeaways for me is more transparency. And I think I may have said this before, but pet owners want a dialogue about what they're paying for, why the veterinarian recommends it, and what is that medical value, if you will, for the pet, right? It's obviously, not exact, but people want to know, because again, they're in the dark, right? It's not something. It's kind of like when I have no idea when I go to the mechanic what they're going to do to my car, but I'm not going to have a 20-minute conversation about what this spark plug or what this thing is going to do to the engine or air conditioning system. But if they're doing it to my pet, and my family member, I'm going to want to know everything that they do. And I want to invest in knowing it, not because I don't trust them, but because it's a family member and you want to know everything about them, what you could be doing. So really going deep and understanding that value and understanding what is being done is so important, right? And it can go a long way once of helping them feel comfortable about spending what might be a difficult dollar amount for them to afford at this time, right? I think the other thing is communicate a range of payment solutions. We always, advise, right? You can talk about, okay, here's what it is if you pay cash now, right? But if you have, something like a CareCredit card where you can break that payment up over a year, so $100 a month is something much more palatable than saying someone's got to pay $1,200 up front. That's a big difference. So that's something that showing them that flexibility, showing them some of the options that are out there are critical. And then, I think the last thing is focus on the budget more than the cost, right? So figure out, what can be done, instill that confidence in the veterinarian. And, it signals that it's a client-focused account as opposed to just like an invoice, right? The research showed that this helped clients, prioritize what was in their pet's best interest. And the veterinarians were in it for them together as opposed to a simple invoice. Not that there's such thing in the vet space, but it's perception.
And so just to recap, that was so helpful. So more transparency, communicate a range of payment solutions, and say words like budget versus cost. And also, we will link to the AVMA Language of Veterinary Care study also in the show notes so listeners can access that. Jonathan, this has been such a fun and informative conversation. Any parting thoughts or words for our listeners?
Yeah, listen, I would say really the pet parent, I would advise really do your research before. Think about all the options that you have out there because you don't want to be left in a situation where you're scrambling at the last minute. CareCredit is there and that product's out there and you can apply in a very short amount of time and get an answer for emergencies. But if you could put yourself out of that stressful position and know that you have a CareCredit card before so that you're not left, kind of having to deal with a finance application during a stressful time, or if you can have insurance before, I think preparedness is so important. I think, and so when you're talking to your first-time pet parents, when they're coming in for their vaccinations or they're coming in for their spaying and neutering, it's important to have that conversation because especially being so many first-time pet owners now, right? It's so important for them. They don't understand, I've been fortunate to have, several share my life or have several pets share their lives with me. And so, I've gone through the cycles, I've been through the ups and downs, and I know I have a better sense of what to expect. But you just don't know. And so, having Maddie here, she's a great dog. She's 13, but, she has Cushing's and that requires, quite a bit of monitoring. She just got monitored for her cortisol levels, right? And making sure that the meds that she is on is calibrated the right way. She has a mitral valve deficiency. And so she had to go to a cardiologist and she's on medicine like that. These are things that thankfully, through both CareCredit and Pets Best, and, I'm able to plan for and afford, but I know that I would be a lot more stressed out if I found out that in the heat of a moment. Of course, you can't predict everything, right? And CareCredit will be there at that moment when you get to that emergency hospital and you're like, oh my God, how am I going to pay for that? CareCredit is available for that. But I'd say always have a plan before. Just take the stress out of what is going to be a stressful experience. And the one thing we know, unfortunately, is that pets are going to have an emergency. So don't do it to yourself and be prepared.
Absolutely. Well, it has been such a treat having you and Maddie on this show. Thanks so much for joining us.
Thank you, Nicole. I appreciate everything you guys are doing for the pet industry and to our practices, and it's been a great partnership.